This is the Coronavirus Morning Report for Thursday, April 9th, 2020. More signs that numbers are peaking while new hotspots also emerge. Data shows the hotspot in New York might have been seeded by Europe, not Asia. A lack of testing is forcing states to set up their own programs. More data on the rollout of antibody testing. Where have all the heart attacks gone? Funerals in the age of coronavirus, and why we now have a national glut of chicken wings. The United States now has more coronavirus cases than Italy, Spain, and Germany combined, and the death toll in the U.S. will pass 15,000 today. New York, New Jersey, Louisiana, and Illinois all reported new one-day highs in terms of deaths yesterday, and New York State alone now has more people testing positive for coronavirus than even the entire countries of Spain or Italy. Globally, the number of confirmed cases is nearing 1.5 million. However, hospitalizations in New York State increased only 3% yesterday, the fifth consecutive day that hospitalizations increased less than 10%. In New Jersey, growth in hospitalizations have nearly stopped. And also, data from yesterday seems to indicate that the decline in positive tests that we've been seeing in New York State this week has primarily been because of a decline in positive tests in New York City. Positive tests as a share of all tests in New York State are declining faster inside New York City than outside of it. As New York continues to be the epicenter of the disease in the U.S., new data sheds light on why that might have been the case. Quoting the New York Times, new research indicates that the coronavirus began to circulate in the New York area by mid-February, weeks before the first confirmed case, and that it was brought to the region mainly by travelers from Europe, not Asia. Quote, the majority is clearly European, said Harm van Bakel, a geneticist at the Icahn School of Medicine at Mount Sinai, who co-wrote a study awaiting peer review. A separate team at NYU Grossman School of Medicine came to strikingly similar conclusions despite studying a different group of cases. Both teams analyzed genomes from coronavirus samples taken from New Yorkers starting in mid-March, end quote. New hotspot alert in the U.S. The Navajo Nation, which is the largest Native American reservation in the U.S., where there are more than 150,000 residents on a reservation of 27,000 square miles across 3 states. The virus there has killed more people in the reservation than in the whole of New Mexico. As of last night, 20 people had died on the reservation compared to 16 in the entire state. But good news from elsewhere, quoting the Washington Post, Spanish Prime Minister Pedro Sanchez said Thursday the country of Spain is approaching a decline in the coronavirus crisis as authorities announced 683 new deaths, down from 757 new deaths on Wednesday. The number of confirmed cases in Spain totaled 152,000, with 5,756 new cases reported within 24 hours. The fire starts to come under control, said Sanchez. This war against the virus will be a total victory, he added, referencing the decline in the daily growth rate of new cases from a peak of more than 20% to less than 4% now. Quote, same as yesterday, there is a downward trend in number of confirmed cases, those hospitalized, and those in need of intensive care, Senior Health Ministry official Maria Jose Sierra said. The numbers show it is decreasing in a generalized manner across all regions, end quote. Hundreds of fast food workers in California are planning to strike today to agitate for better protective equipment and paid sick leave. And while I'm sure the advice still holds that everyone should continue exercising to preserve your general health, even if that means going outside to do it, there is a worrying new study that suggests that doing so is not an activity without risk, quoting the Washington Post. Anyone who goes outside to exercise may need to keep an even greater distance from other runners and joggers, a new European study says, in order to properly practice social distancing. Researchers at KU Leuven in Belgium and the Eindhoven University of Technology in the Netherlands found that someone infected with the virus could pass on respiratory droplets to people more than 6 feet behind them through a kind of vacuum they form as they cut through the air. When you are moving, running, cycling, walking, you are actually creating an area behind you that is called a slipstream, Bert Blocken, who coordinated the study, told the Brussels Times. Athletes often use these slipstreams to run or bike at higher speed, Blocken said. According to a series of simulations run by his team, a jogger moving at about 2.5 miles per hour was likely to come into contact with the slipstream and thus the droplets of someone exercising as much as 50 feet ahead. The study suggests that runners and cyclists may want to avoid moving directly behind another person and falling into their slipstream, Blocken said, by moving side by side or in a staggered formation. When such a formation is unavoidable on narrow paths or sidewalks, those seeking an outdoor workout should stay at least 15 feet apart when walking, 33 feet when running or cycling slowly, and 65 feet apart for more vigorous exercise, he told the Globe and Mail, end quote. More interesting data points with differing implications. Western Europe has a population roughly the same as the U.S., with 384 million people versus 327 million people in the U.S., but Western Europe thus far has 154 corona deaths per million people, while the U.S. currently has 45 deaths per million people. So the U.S. is currently recording 1/3 as many deaths per million as Europe is. Caveat there. In terms of demographics, aging populations, and Europe being a few weeks ahead of us on the timeline, of course. But also, according to the same data points, people under the age of 65 in New York, Louisiana, and Michigan are dying from coronavirus at a greater rate than in 8 European countries. In fact, people under 65 in New York are dying at 46 times the rate of Germans under the age of 65. As Dr. Scott Gottlieb tweeted, socioeconomic factors may be impacting outcomes. Data suggests U.S. deaths cluster in areas with high levels of poverty, end quote. Finally, let's end the segment with something a little lighter. An unlikely side effect of coronavirus and the canceling of March Madness here in the U.S., there is now a national surplus of chicken wings. Quoting the Washington Post, the NCAA basketball tournament is the second of 2 big annual events for chicken wings. The first is the Super Bowl. Wing prices and production run in predictable cycles each year, ramping up for the NFL playoffs and championship game in early February, and then again for college basketball's frenzied tournament a month and a half later. But with society in lockdown because of the novel coronavirus and the NCAA tournament canceled, that's left a whole bunch of wings lying around, and now they've flooded the market. Ergo, we have a giant national surplus of chicken wings. That is a fact, said Will Sawyer, lead animal protein economist at CoBank. That is real, end quote. Wings, the most expensive part of the bird, haven't been this cheap since September 2011, according to U.S. Agricultural Department data. They sold for close to $2 per pound the weekend of the Super Bowl. Now they sell for half of that. Poultry producers sold 1.24 million pounds of wings the week the tournament was supposed to start. Last week, they sold 433,000 pounds, end quote. Yesterday, I mentioned Dr. Scott Gottlieb's urging the country to enact a testing, tracing, and targeted re-isolation campaign that might even include the use of people's smartphones to stamp out flare-ups and new outbreaks as they happen so that we all can return to normal life sometime in the near future. In fact, Dr. Gottlieb co-authored a comprehensive plan to enact this sort of system, which is linked in the show notes. And quoting the Washington Post, Gottlieb, in a new paper written with experts including Mark McClellan, FDA chief during the George W. Bush administration, argues that the nation needs to create a massive testing and surveillance infrastructure by late May to try to get ahead of the epidemic and prevent an autumn comeback. He said the government should focus on the mass distribution of rapid point-of-care tests to hospitals, clinics, and doctors' offices, end quote. A testing, tracing, and emergency limited, targeted quarantine system in place by May. Sounds like a plan to me, but while we wait for the federal government to put such a system together, the Post is also reporting some states simply aren't waiting. Quoting again, in Utah, the University of Utah and Intermountain Healthcare worked with ARUP Laboratories to develop mobile testing sites. On Thursday, TestUtah.com was launched to allow residents to fill out an online survey to determine whether they need coronavirus tests and to book appointments to be tested. The venture is similar to one President Trump described a month ago that has not materialized nationwide. California Governor Gavin Newsom assembled a task force on Saturday, co-chaired by Assistant Director of the California Department of Public Health, Charity Dean, and by Blue Shield of California President and CEO Paul Markovich. One member of the state task force who spoke on the condition of anonymity emergency to avoid disrupting help from the federal government, said California pressed ahead with initiatives such as establishing 8 testing hubs in collaboration with public and private universities and Kaiser Permanente because it had no choice. Quote, "We're making up our strategy because the federal government has been completely out of touch," the task force member said. Quote, "We can't mobilize a health response without knowing how this disease is spreading," end quote. Connecticut's governor has also formed a task force to develop a testing strategy. One focus, called Project Haystack, is aimed at detecting contagious individuals. Quote, "The tragedy that we find ourselves in is that we didn't do the testing early enough," the task force member David Shear, president of a venture capital firm and advisory firm, said. And in Maryland, where Governor Larry Hogan initially requested a testing site, state officials are now working with Gottlieb to implement their own plan. Quote, "The request for the federal testing site is no longer our top priority," Hogan said in a recent interview, end quote. Concerns continue that a lack of testing here in the U.S. could be leading to an undercounting of coronavirus cases and especially deaths, quoting from CNN. With concerns growing about the coronavirus death toll being incomplete because of lack of testing for the living, coroners and medical examiners said being unable to test the dead compounds the issue. They said they are worried that deaths are being significantly undercounted and that as a result, the statistics used by the federal and state governments to chart the virus's spread and severity are far from reliable. Contacts of the deceased may not get the warnings they need to help keep the disease from spreading. Families may be left not knowing what killed their loved ones, end quote. A lack of testing ultimately hampers our ability to fight the COVID-19 outbreak since we won't know its true parameters. Quote, "If you die in my county, I will not know if you died of COVID-19, one Colorado coroner who can't get a hold of tests for the dead told CNN. I will, however, be able to tell you if you legally smoked pot," end quote. Arkansas had only 16 COVID-19 deaths listed thus far earlier this week, but 2 coroners told CNN they can't get enough tests to check bodies. Quote, "Bodies are not tested for COVID-19, one emailed in frustration, period," end quote. State health authorities are admitting that this may be leading to an undercount of COVID-19 deaths across the country, as recorded by the official CDC death toll. Some states like Colorado count suspected deaths. Others, like Arkansas, only submit cases to the CDC when a COVID-19 test has come back positive. And the situation appears to be worsening in many states, quoting again from CNN. In Ohio, meanwhile, Franklin County Coroner Dr. Anhai Ortiz believes her office has already seen at least 4 coronavirus deaths that were not counted. Though she couldn't release personally identifying information, she said 2 were in their 40s and 2 were in their 50s. One woman had been homeless and staying with a friend when she died. Another man had recently traveled to Florida, and his employer called the police when they didn't hear from him. All 4 had fevers and other common coronavirus symptoms, said Ortiz, and they were all found dead at home. But none of them were tested. With only 8 precious tests left, she said, she decided to save them for infant deaths to test for COVID-19 and other viruses. They're not going to be counted, said Ortiz, who said her office only reports positive cases to the state. Your fatality rate is not a true fatality rate, she said, end quote. An inaccurate death count has profound implications for the living as well. Contact tracing and quarantine becomes patchwork without accurate numbers, if it happens at all, meaning the outbreak is not being properly monitored and controlled. And it places coroners and medical examiners at personal risk as well. Are they dealing with someone who died of or with coronavirus or not? We return to our mantra on this podcast: testing, testing, testing. Testing remains the key to everything. And while a lot of U.S. states are being forced by this lack of testing to go rogue and try to implement their own testing procedures without federal assistance, in Europe, some nations, as we've said, have already been looking ahead to reopening, hopefully with the assistance of some type of immunity testing. Germany, which has set an enviable model of testing 50,000 people a day for coronavirus, has recently shifted their focus to this antibody testing. Some tests would determine if someone has already had the virus and is therefore theoretically immune to reinfection. And Germany's first test kits for mass coronavirus antibody screening were certified at the end of March. On Tuesday, IFLB labs in Berlin processed 70 antibody tests. Quoting the Washington Post, in Germany, studies already underway or planned over the coming months involve a sampling of roughly 100,000 people. One by the University of Bonn will study 1,000 people from the hard-hit town of Heinsberg. Another in Munich will repeat tests on the same sample group regularly to monitor spread, end quote. However, even with these tests, Germany has not yet joined Austria, Denmark, and Norway in announcing plans for reopening schools and small businesses later this month. Chancellor Angela Merkel has said she doesn't want to raise people's hopes prematurely. And quoting the Washington Post, European governments are mulling the introduction of what has been dubbed immunity passports to let individuals who have had the virus return to a more normal life. German scientists caution that this stage of the response is still a long ways off. There remain crucial questions over how long someone's immunity might last and at what level, and there are concerns about tests producing false positives and insufficient capacity for widespread testing, end quote. Even if Germany is able to roll out these tests on a massive scale, as they have their initial coronavirus tests, would the data actually be useful enough in targeting and containing the virus to allow the reopening of society? Roman Skablo, the head of the Berlin laboratory, said in the Washington Post, "The question is, if someone tests for the antibody, what does that mean? Immunity? Part immunity? For how long? If someone asked me, what can I do with the results? I wouldn't be able to answer," end quote. Stamps.com brings all of the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. I've been telling you about how this allows you to stay inside and avoid crowds like we all should be doing right now, and I've told you how this will help small businesses continue to function even while working remotely. But did you know Stamps.com also saves you money with discounts you can't get at the post office? You get 5 cents off of every first-class stamp, for example, and up to 40% off USPS shipping rates with Stamps.com. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates up to 62%. Plus, with Stamps.com, you won't even have to pay UPS residential surcharges. Stamps.com is a no-brainer, especially now, saving you time and money and keeping you safe in these crazy times. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing, BRIEFING. Stay safe, everyone. Life feels more stressful these days. No kidding. Stores are empty, travel is on pause, work is uncertain. With social distancing now, we need support more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging across any device and hear back daily. 1 month on Talkspace costs about the same as a single in-person therapy session, but with that unlimited messaging access I just mentioned and daily engagement. No need to travel for support or wait for relief. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. We all need to talk through life's challenges, and Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use the promo code BRIEFING for $100 off your first month. And more confusion around numbers. In the New York Times on Monday, Dr. Harlan Krumholtz shared a surprising fact about Yale New Haven Hospital, where he works. Despite the fact that they have 300 and counting patients with COVID-19, the hospital is not yet at capacity. In fact, they have more empty beds in the hospital than they usually do around this time of year. He notes that some of this is intentional, that the hospital canceled elective procedures and have switched to telemedicine for many patients. But the strange thing is that non-coronavirus-related emergencies have subsided. And it's not just at Dr. Krumholtz's hospital. Quoting the New York Times, in an informal Twitter poll by Angioplasty.org, an online community of cardiologists, almost half of the respondents reported that they are seeing a 40% to 60% reduction in admissions for heart attacks. About 20% reported more than a 60% reduction. And this is not a phenomenon specific to the United States. Investigators from Spain reported a 40% reduction in emergency procedures for heart attacks during the last week of March, compared to the period just before the pandemic hit, end quote. Other doctors on Twitter have noted they are also seeing less emergency patients with acute appendicitis and acute gallbladder disease. So what gives here? Krumholtz writes in the New York Times, quote, "The most concerning possible explanation is that people stay home and suffer rather than risk coming into the hospital and getting infected with coronavirus. This theory suggests that COVID-19 has instilled fear of face-to-face medical care. As a result, many people with urgent health problems may be opting to remain at home rather than call for help. And when they do finally seek medical attention, it is only after their condition has worsened," end quote. More optimistically, however, Krumholtz notes that maybe as people are staying home and social distancing themselves, there are less triggers for emergencies. People may not be engaging in physically risky behaviors. They may not be eating or drinking excessively. But Krumholtz doesn't think that alone would explain the drastic reduction in emergency cases. In fact, he expects we should be seeing more heart attacks, as respiratory infections in general and COVID-19 in particular can greatly increase the chance of a heart attack. Not to mention the heightened stress and anxiety of living through a pandemic, which also increases the risk of heart attack and stroke. If one of the reasons there are less non-coronavirus emergency patients right now is because people are avoiding treatment in order to avoid putting a strain on hospitals or to avoid contracting the virus, Krumholtz says, quote, "The public needs to know that hospitals are equipped not only to care for people with COVID-19, but also those who have other life-threatening health problems. Yes, we in healthcare are working to keep people out of the hospital if we can, but we can safely provide care for those people who are not sick from COVID-19. Masks and protective gear for healthcare workers and patients go a long way to ensure a safe environment. Also, people with chronic conditions need to know that avoidance of needed healthcare could ultimately be as big a threat as the virus itself," end quote. In March, I shared a number of first-person perspectives from healthcare workers on the front lines and from individuals living with coronavirus in order to present what it's actually like out there right now, beyond all the headlines and rapidly emerging theories. Just, real people's experiences. Now that the virus has been running its course here in New York City for several weeks, I also wanted to share a perspective on a topic that's pretty grim, but unfortunately one that many of us may have to face and might have questions about. Grieving. Funerals. Specifically, how funerals are working now during the coronavirus pandemic. Like with all of the first-person stories I've shared, there's no way to know for absolute certain that this or that person we're about to quote from didn't make some of these details up. But this one case in particular seems pretty genuine. It's from the New York City subreddit, and I'm going to quote pretty heavily from the post, so here goes. Quote, "A relative of mine passed away last week. They were COVID positive, and after spending a few days in hospital, passed away ultimately from respiratory issues. A very kind doctor called me, as I'm next of kin, and had been handling the situation. They were very sorry for my loss and said I should wait for a phone call to get next steps. I had read about mass funerals, temporary graves, and some other scary stuff, and so my anxiety got the better of me, and after a few hours, I just started making calls myself. I didn't want my relative to be accidentally buried in a mass grave. Is that even happening anyhow? I've had the misfortune of handling funerals before, so I knew that I needed to get in touch with a funeral home. I called one at random who didn't pick up. I then called a second that was also nearby. They picked up and could accommodate my family. The folks at this funeral home, as I expect others have been, are way inundated with deaths. The guy who has been my contact has been nothing but amazing, but has told me most who have called have been extremely stressed and rude," end quote. The anonymous poster then shared some responses to common questions about the current status of funerals in New York City. There are no visiting hours in cemeteries. Burials can have a maximum of 10 people attending, but the funeral home this poster went to allowed the family to schedule a separate memorial at a later post-pandemic date. Bodies must be double-bagged, and funeral homes are not allowed to dress the bodies or touch them much beyond taking a photograph. Coffins, too, have to be bagged. A commenter identifying themselves as a New York City funeral director explained, "This is out of an abundance of caution since body bags have a frequent tendency to rip, and that we aren't entirely certain the patient is no longer contagious just because they've passed away. The original poster also noted that cremation does appear to still be an option, but it wasn't what their family member wanted. Earlier this week, rumors swirled about New York City making plans for temporary burials at one of the city's parks. It was later clarified as merely a contingency plan, one that Mayor Bill de Blasio says we are not yet close to, and that the site for temporary burials would be Hart Island in the Bronx, not a public park. As of now, the morgues have, quote, adequate capacity here in the city. Going back to the segment about undercounting deaths, however, we may be closer to capacity than we think. Aya Worthy Davis, a spokeswoman for the New York City Medical Examiner's Office, says at-home deaths are exploding. She told the New York Times that before the pandemic, there were about 20 to 25 at-home deaths a day. Currently, there are about 200. So who knows how things might change in the coming weeks. But thank you to the Reddit poster for sharing what it's currently like, at least here in New York City. That's all for today. Talk to you tomorrow morning. Be well, everybody.